Hi, Assalamualaikum. Today we are going to talk about iron deficiency anemia. It is one of the anemia type. Next, I will give you the idea what is iron deficiency anemia. This IDA is happen due to the insufficient iron in the body. It causes the unable to produce enough red blood cell. So it will disrupt the flow of red blood cells which carry the oxygen. Thus, it causes a person to feel tired and short of breath.
Etiology. Hemorrhage causes iron depletion. When bleeding happens, the production of hemoglobin increases, causing the amount of iron stores to decrease. Inability to absorb iron. This can be caused by celiac disease as well as gastric bypass. It can limit the amount of iron that can be absorbed by the body. Internal bleeding. This causes loss of blood, and since blood contains iron, loss of blood can lead to iron depletion. Dietary factors. Iron deficiency anemia can be caused by lack of iron-rich food intake in the daily life.
For the pathophysiology, the decrease of iron unable to support normal red blood cell. It also depends on the input and output of the iron in our body. So it is important to maintain the balanced equilibrium of the iron. Diminished absorption iron due to insufficient intake of iron in suitable form.
Diagnosis. 5 tests that can be done are complete blood count. You can observe low MCV, low mean corpuscular hemoglobin concentration, normal or elevated white blood cell, and elevated platelet count. Peripheral blood smear. For the lab finding, you will observe an increase in platelets, absence of target cells, anisocytosis and poikilocytosis unmarked, and in chronic cases, red blood cells are hypochromic and microcytic. Serum iron and serum ferritin, where there will be presence of normal serum ferritin and low serum iron and ferritin. Total iron binding capacity, where there will be an elevated TIBC, and lastly, reticulocyte hemoglobin content. What can be analyzed? The size and color of red blood cells, hemoglobin level, hematocrit level, and lastly, ferritin level.
Next, let's go through about the treatment. We will treat by iron supplement. As for example, the first is the iron therapy. It is used oral ferrous iron salt as a medication to treat iron deficiency anemia. Parenteral therapy for patients that cannot use oral iron or have increased anemia using oral iron. Next, take iron tablet on an empty stomach. Then, take iron tablet with vitamin C. And please do not take iron with antacids. How about treating underlying causes? Firstly, we can take antibiotic for peptic ulcer and medications such as oral contraceptive. And then for the surgery, it used to treat bleeding, polyp, tumor, and a fibroid.
Islamic perspective. Islam taught us to always prioritize our health. Health is a fundamental right to all humans in the world. It is also one of the gifts from Allah subhanahu wa ta'ala to all His creatures. Therefore, it is our responsibility to take care of our health. As we know, iron deficiency anemia is one of the diseases that we can prevent by taking several precautions to avoid the disease. Islam also taught us to seek for help when we're in trouble. Henceover, if we suffer from iron deficiency anemia or other diseases, we are obliged to try to find the treatment or solution to cure the disease. However, if a patient is suffering from a terminal condition and has been assessed as having no hope for recovery, it is permitted to stop medical treatment. As Muslims, we should always have tawakkul in Allah and believe that any diseases can be cured by His permission, as Allah has mentioned in Surah Al-An'am verse 17, and if Allah should touch you with adversity, There is no remover of it except him. And if he touch you with good, then he is overall competent.